Good morning. My name is Dr. Jan Pinchevsky, and I work within the Medical Affairs Division at Takeda. And Takeda essentially has a purpose, and that is better health for people and brighter future for the world. And we do this through discovering and delivering life-transforming treatments, which is guided by our principles, and our commitment to patients, people, and the planet.
Yeah, it's an honor to have you today, Doctor. I follow the work of Takeda, and it's pretty amazing. So today we're speaking about lymphoma. It's the 15th of September, and today is Lymphoma Day. What does that mean? What is Lymphoma Day?
Great. So Lymphoma Day is, or lymphoma, the World Lymphoma Awareness Day happens on the 15th of September every year. And it is essentially, it's the type of day where we talk a little bit more about a very important cancer, a cancer that's a little bit more rare than breast cancer, prostate cancer, colon cancer, lung cancer.
Yeah.
But this is a cancer which many people around the world, unfortunately, do get. And we need to be able to talk about it, and we need to be able to get these people diagnosed, and hopefully their doctors will decide on a way forward for them in order to give them a better outcome.
And how is Takeda commemorating this day?
Well, just to take a few steps back, I work for I have the privilege of working for an organization that has an R&D department where we spend a lot of our time and effort developing treatments for lymphoma, both the Hodgkin's lymphoma and the non-Hodgkin's lymphoma.
Okay.
What we do every single day is try and make sure that we develop new therapies, we develop new treatments in order to help people tackle this horrible disease. A disease that can be said is a little bit more indolent, or in some cases slower growing, but some patients do have a more aggressive form of the disease. So we're heavily involved in that. There's educational initiatives. There's a lot of things which Takeda on a day-to-day basis gets involved in to make sure that patients know a lot more about, them, having something wrong, them getting it checked out, presenting to their doctors, and then doctors having some tools available to them to hopefully use to make people better.
You mentioned two types of lymphoma. There's Hodgkin and non-Hodgkin. What is that? And is it genetic? How does one develop lymphoma?
Great. So let me start from the beginning. Lymphoma is a cancer of the lymphatic system. What is the lymphatic system? The lymphatic system is a part of your immune system. And in your lymphatic system, you've got lymphocytes, which are these cells. You've got T cells and B cells, and they're responsible for killing viruses, bacteria, fungi, any pathogens. So it's your immune system. And sadly, with lymphoma, these lymphocytes, they develop an abnormality through DNA mutations, and then they continue surviving and replicating, abnormally growing, and then they crowd out the normal healthy ones. And then patients get sick. You ask about, who are the patients at risk? Is it genetic? Can be genetic. We don't know the exact cause. What we do know is, and there's a lot of research on the go right now, we do know that, for instance, in Hodgkin's lymphoma, there's two peaks. In other words, patients get it when they're between 20 and 40, or they get it over 55. Whereas non-Hodgkin's lymphoma, as you get older, the risk increases. And essentially, there's a virus called Epstein-Barr virus, which puts you at risk of developing this lymphoma, this cancer. There's Helicobacter also, and then patients with impaired immune systems. So patients with HIV, are at increased risk. So obviously they would need to try their best to, to have their HIV controlled.
Yeah.
There's a lot of risk factors. Yes.
This is really insightful, Doctor. So what are some of the warning signs of lymphoma?
Great. And that is the most important thing.
Yeah.
So our lymphatic system is spread around our body, and patients have got a number of symptoms that they experience. And by the way, these are very common symptoms, which you'll think about as normal flu-like symptoms, but it doesn't mean that you've got cancer when I do list these things. So number one, patients experience a lot of tiredness, shortness of breath.
Yeah.
They get painless growths around their necks, in their armpits, maybe on their chests or their groins. They can get a rash. They get these night sweats, unexplained weight loss. If all of these things happen, it doesn't necessarily mean that you've got lymphoma, that you've got cancer, but it should prompt a patient to go get checked out.
Yeah.
And really the doctor would go and they would do investigations, which I can talk to you about what they would do.
Yeah. Okay. And how long does it take for it to spread?
Okay. So patients are all very different.
Yeah.
And there are different types of lymphomas, the non-Hodgkin's and the Hodgkin's, and you can break it down even further.
Yeah.
And you get different aggressive levels of the disease.
Mm-hmm.
Some take many, many years for them to, start causing problems in the body.
Yeah.
And in those cases, those patients, their treatment wouldn't necessarily involve them having anything radiated or cut out, or even chemotherapy.
Mm-hmm.
We would go and we would actively monitor them, and they would keep following up over a time period. Their doctor would determine how.
Yeah.
And then you've got the more aggressive ones where the doctor would need to, with the rest of his or her colleagues, decide on what the best approach would be, and therapy would begin a little bit sooner.
Yeah.
Luckily, there is really good tools, and treatment over the last 3-4 decades has drastically improved the outcomes, meaning the treatments are working better, making people live longer, and it's less side effects, which is great. So that means better quality of life.
Yes, yes, absolutely. And you did say that it's not like any other cancer. Can it be cured?
So in general, we can treat it, and we can get patients to a level where they've cleared the disease. And in that setting, the patient would still be followed up. The doctor would still request for the patient to come in, and they would determine, depending on the disease, the treatment, every patient is different, but you can get it to the point where the patient is no longer in therapy and they're back to life. They're functioning socially, occupationally, and they're okay.
Yeah.
So there's a lot of success that we've had, even with the more aggressive lymphoma cases. So yeah, we've had a lot of patients that have gone back to normal lives.
Oh, I love that. That's fantastic. And lastly, how can people contribute towards fighting lymphoma?
Great, that's an important one. So number one, I mentioned it earlier, you asked me about, picking up symptoms, signs and symptoms.
Yeah.
So, if you're short of breath, if you're tired, if there's night sweats, if there's a rash, if there are these growths that you have around your body, get it checked out. If a family member, a loved one, a friend, someone in your community happens to have any of those signs or symptoms, they need to go to the clinic. Whether it's public or private, we've got excellent doctors in our country, doctors that deal with this on a day-to-day basis. We've got incredible therapies, and there is solutions in place. We need to make sure that people know that it's something that can be solved and we can work through together. They need to go to their clinic, they need to speak to their doctors. There's also support groups, you know, patients that have got this disease, they can speak to each other about, you know, their journey, you know, how they presented, how it was picked up, what treatments they've gone through, you know, how they got better. And you know, between your friends, your family, you need to bring them in close together if you have this diagnosis. And you need to be patient, and you need to make sure that, you know, you continuously listen to the healthcare professionals, because, you know, they've gone through seeing a lot of these cases, and they've got, you know, they've got the experience, which will help them make a decision that'll give you hopefully a better outcome.
Great. Thank you so much, Doctor. This was really, really insightful. We appreciate it.